How can we avoid a future pandemic? Medical experts have a plan, and it's called One Health. What is the One Health strategy?
The One Health strategy is based on linking between the different elements of health that govern our planet. Human health, of course, there's animal health in there, but also environmental health.
One Health, which is advocated by the World Health Organization, is designed to implement policies and programs where professionals with a range of expertise, like vets, doctors and environmental scientists, can join forces and share data to help avert another pandemic. Why is it important to understand the links between human and animal health?
We already know that about 60% of infectious disease we have in humans actually came from animals.
Most of the emerging diseases that we're concerned with come from wildlife, and we've seen jumps from markets before. So when we bring wild animals from all over the world and mix them together and in unhygienic conditions where bodily fluids are able to mix, and then people are in the picture and the animals are butchered and the products are sold, we are creating the absolute perfect storm to allow viruses to jump.
How would One Health detect an emerging disease?
If we were to set up surveillance at places where humans and animals come in frequent contact, such as the live animal markets, such as the meat processing centers, such as heavy poultry markets in Asia, if we could work with veterinarians and human health personnel in studying the workers and studying the animals, then we can get ahead of these viruses and other pathogens.
Has the One Health approach detected any diseases before?
We've detected, for instance, influenza virus D in poultry that we didn't think was there before. We found evidence of unusual respiratory virus called adenoviruses in people with pneumonia. And it's using these collaborative efforts between human health and animal health, and sometimes environmental health, to where we make big discoveries.
What can we learn from the outbreak of COVID-19?
Today, in 2020, whether we're talking about an urban center in China or in the United States, it doesn't matter. If we don't need to be consuming wildlife transported from all over the world to meet our basic nutritional needs, then we have to be very, pragmatic and recognize that the risks of these activities far exceed the benefits to a very small subset of people. If a given species sells for $3 a pound, but the global costs of that transaction are closer to maybe $30 million a pound, but that seller and that buyer aren't the ones bearing those costs, we all are, that type of transaction doesn't make economic sense in today's world.
Health experts hope that we can learn from COVID-19 and previous outbreaks involving animals. They hope the One Health preventative approach will be implemented into public policy to reduce the risk of future pandemics. But it'll only work if there is collaboration across all governments.